Now, I'd like to call the meeting of the board to order. Will the secretary please call the roll?
Director Bott.
Here.
Director Curry. Director Garza.
Present.
Director Harrington.
Present.
Director Kim. Present. Director Ryder.
Later is here.
Director Robinson is absent. Director Sorrell
Present.
is absent. Director Webster Cross
Present.
and Chair Taylor.
Present.
You have a quorum.
Thank you. The next regular meeting of the board will be held on Friday, September 27th at 9 a.m. promptly. At this time, I'd like to entertain a motion to allow Director Webster Cross to participate remotely as a voting member. So moved. Second. Thank you. The motion has been made and seconded. Any discussion on the motion? All in favor? Aye. Aye. All opposed? Thank you. The ayes have it. The motion carries. The first item on today's agenda is employee recognition, which will be reviewed by Director McIdas.
Thank you, Chair Taylor. Good morning, directors. As always, we're going to start with our new hires. We want to welcome Benjamin Lawton, Chief Nursing Informatics Officer, Efrat Stein, Director of Public Health Communications, Reed White, Compliance Officer, Jacqueline Zavala, Senior Operations Manager, Health Plan Services, and Afifa Khan, Food Security Program Manager, excuse me. We also want to congratulate our new leaders who earned promotions over the last month: Pierre Nunez, Chief Correctional Psychologist, Kalyani Paramal, Chair of the Division of Renal Disease Nephrology, Joseph Price, Executive Director of Ancillary Services, and Danielle Smith, Nursing Services Business Operations Manager. Next slide. Shifting to recognition, we announced on August 7th the plans to open our Bronzeville Health Center. We're planning to be fully open by early 2025. The facility will be anchored by the historic Provident Hospital. The Bronzeville Health Center will offer family medicine, behavioral health, and rehabilitation services, including physical therapy, occupational therapy, and speech therapy. It'll be a 26,000 square foot facility projected to see 85,000 patients in the first year, and we'll have 44 exam rooms as well as gym space for therapy services. Very exciting.
Very exciting.
We also celebrated the Bud Billiken Parade on August 10th. Cook County Health had a strong presence there. We had 2 floats for county care as well as the health system, and also staffed our medical tents along the parade route. And thank you. I think we have some of our participants here. Thank you for your support.
Thank you.
That's the end of the formal slides. I do want to take a second to recognize our teams who supported the DNC work. This team really helped ensure the continuity of care and services were available for patients, our members, and our communities. Extremely grateful that the events ran smoothly. The activity was largely peaceful as well. We had countless individuals involved in Cook County Health's readiness efforts over the last 8 months, and it's thanks to all of your hard work that everything went so well. Your commitment to safety and well-being for Cook County residents and visitors, especially during this high-profile and potentially challenging time, was truly commendable. Thank you all.
Thank you very much. Well done. Really appreciate it. Thank you.
That concludes the report.
Thank you. Thank you all again. Congratulations to all the new employees and promotions as well. The next item is public. Yes.
Director Sorrell is also remotely connected.
Thank you. There you go. Given that, I'd like to entertain a motion to allow Director Sorrell to remotely participate in this meeting as a voting member. So moved. Thank you. The motion has been made and seconded. Is there any discussion? None. All in favor? Aye. All opposed? Thank you. The ayes have it. The motion carries. The next item is public testimony. As a reminder, written testimony will not be read into the record, but will be included in the official record of this meeting and posted to the website. Madam Secretary, do we have any speakers who've registered to provide in-person or virtual oral testimony or submitted written testimony?
We received 4 registrations for in-person testimony. We received 1 written testimony, which will be included in the record. You have copies in your packets, and it'll be posted to the website.
Thank you.
The first speaker is Dr. Ngozi Ezike.
Oh,
And each speaker has 3 minutes. As you have 2 minutes have elapsed, I'll give you a reminder.
Thank you.
We know you have the skills to do it. We've all watched you for years.
I'm new to the microphone. Again, my name is Ngozi Ezike, and I'm the CEO of Sinai Chicago. I'm here today to offer testimony in support of the budget for Cook County Health and the County Care Health Plan, which continues to be a vital component of the healthcare infrastructure in Cook County. Our system at Sinai is an inclusive system of 3 hospitals, community clinics, a research institute, a community institute, as well as a level 1 trauma and a level 3 NICU. We serve about 4,000 county care, primary care patients, and just last year admitted over 750 county care patients. So we have partnered with county care through the MHN ACO for 10 years. The forward-thinking arrangement between county care and MHN ACO acts as an economic engine in our communities, creating hundreds of community-based jobs in designated, disproportionately impacted areas. The MHN ACO is wholly owned by the FQHCs and the Safety Net Health System providers. And together, we bring a fully integrated, community-based, whole-person care approach to the county care population. And we are the provider of hospital services and primary care, the care manager, and the coordinated system of care for county care patients. But more than just talk to you, talk at you, I really want to share with you what this looks like. A county care MHN ACO patient came to Sinai with a partial foot amputation due to long-standing diabetes and the complications associated with it. Our care manager contacted the patient and identified that the wound had not been dressed in over a week. So the care manager immediately jumped into action, got the patient in for an appointment with the podiatrist. That involved arranging transportation to get the patient there and back home. And then the patient was actually met by the care manager at the appointment. The care team then recognized that there was danger, that this patient needed surgical intervention immediately if they were going to have a chance at saving the rest of the foot. So the patient was admitted, the patient received the treatment, and further amputation was avoided. So yay, sounds like a win, but that's not where it stops. The patient was discharged and the support team continued to act. The care team followed up with the patient as an outpatient, followed up with diabetes education, followed up with medication education, continued with the transport support to get the patient back and forth to the follow-up care for the surgery. The care team provided follow-up care for weeks after the surgery until the patient had actually trained family members that could do the dressing changes for him. So this is the example of the continuum of care. That's the process that we want to see. That's how the patient learned how to stabilize their blood pressure, learned how to stabilize their diabetes. In fact, the patient literally said that this has been a miracle of how this team has been able to support him. And this success is not just about the operating podiatrist. It's not about a single nurse. It's about the team. It's about the complete support. It's about dedicated team focused on the patient. And in that setting, with this model, we can overcome even the toughest challenges that our patients face. So we support county care wholeheartedly. We thank Cook County Health and County Care for being such great partners. I'd like to thank Board Chair Lyndon Taylor and the entire Board of Directors for everything that you're doing to support us having the healthiest, most vibrant county and community. Thank you very much. Thank you. Appreciate it.
The next speaker is Lena Hatchet.
Hi, thank you all. I'm Lena Hatchet, founder of Proviso Partners for Health and a member of the Racial Equity Learning and Action Committee. I want to start by sharing my deep thanks and appreciation to the Cook County Department of Public Health for their tireless effort to promote community partnerships and sustainable community transformation. I started working with the Cook County Department of Public Health in 2006. And at that time, we were a small group of residents in a library building creating a Maywood action plan of how we could address structural racism in our community. That small meeting led by the Cook County Department of Public Health, convened by them, was visionary for our community residents. The question was, what can we do together to create a change in our community? And members at that table at that time in 2006 are now running their own nonprofits and organizations to transform health. One of the members at that table at that time that I remember so deeply is Miss Deborah Vines, and Miss Deborah Vines won the CNN Heroes Award 2 years ago for her efforts to transform autism in the Proviso community. Examples like that are just one. The Cook County Department of Public Health staff and in critical funding, they actually gave us $110,000 in 2011 to address and reduce obesity. But the power of that transformation wasn't in the dollars, it was in the people. Our residents used their voice, and Cook County Department of Public Health with the county health system listened. We took every single one of those dollars and we built a garden. That garden then built awareness, and residents grew their own food. Then we partnered with advocates. Then we partnered with growers.
Pardon me, you have 1 minute remaining?
And again, Cook County Department of Public Health linked us to organizations to advocate and change the food justice movement in Proviso. I urge you to listen, to invest in the community voice, to use them as a partner and listen to community solutions for mindset change on addressing structural racism. The Cook County Department of Public Health cannot do it alone, and we need to experience the lived experience of those with inequities on race, class, and economics. And we want to, with the Building Healthy Communities initiative, continue to spread multi-sector coalitions to transform health outside of the healthcare system so that so many people are prevented from being caught with chronic health disease.
Excuse me, 3 minutes have elapsed.
Thank you.
Thank you.
The next speaker is Jackie Burgess Bishop.
Good morning. I'm Jackie Burgess Bishop, and I'm the CEO for the National Kidney Foundation of Illinois. I want to extend our appreciation for this opportunity to provide comment and testimony for the Cook County Health System's budget. We know that 1 in 3 persons are at risk for kidney disease, and through our partnership and relationship with multiple departments and entities within the total health system, we know Cook County Health is committed to changing that trajectory for kidney disease. We work in multiple areas. So one area includes the Cook County Department of Public Health, where we have received a grant through their Building Healthy Communities Award to really do a deep dive in 4 communities, 4 suburban communities, 2 on the south side, 2 on the west side, where we engage with community health workers. We engage in empowering patients with our Take Charge program that educates on how they can take control of their health. We provide screenings from the prevention standpoint because we really want to move kidney disease up the care continuum. And we look at early screening, detecting as a way to do that. With other areas within the health system, we serve on 3 of the community advisory boards within the health system, which include the Cincinnati Provident Board, Advisory Council as well as Cottage Grove and Belmont Credit. So with that, and the partnerships that have grown from that, and the opportunity to raise awareness, we know that kidney disease is considered a silent disease. People are not aware and often crash into dialysis. When we look at the fact along the continuum that those that do advance to end-stage renal disease as a result of the Cook County Health System's investment at Providence Hospital in a state-of-the-art dialysis center, we know that they will receive care.
Pardon me, you have 1 minute remaining.
All right, thank you very much. Again, we want to thank the health system, encourage investment as we look at to the future, engaging with the aspects of behavioral health and maternal health for persons that have kidney disease as well. So we see this relationship continuing, growing, and expanding, and thank you very much.
Thank you.
The final speaker is Esther Corpus.
Good morning. My name is Esther Corpus, and I'm the CEO of Alivio Medical Center. I'm here today to offer testimony in support of President Preckwinkle's proposed budget, including dollars supporting Cook County Health and County Care Health Plan. Alivio is a federally qualified health center. We have 7 locations, predominantly in the Chicago Latino community, but also in the Berwyn-Cicero community. We serve a largely Latino Mexican population. Alivio is also the founding organization for Healthy Illinois, which many of you know, we were the first in the country to pass Medicaid expansion to undocumented seniors and adults, which many of the county care patients are now benefiting from. Alivio has participated with county care through the MHN ACO since 2014. We have embraced really that relationship, and we are very, very grateful. I think I speak not only for Alivio, but really for the FQHC community, that this partnership is very important, and it's very community-based, and it's providing the care management at the practice level, which we are very grateful for. We also believe that we're a great partner. We strive to make sure that the MHN ACO is providing care management to at least, currently right now they're providing it to 171,000 lives, and we are proud to serve at Alivio approximately 7,000 county care patients. I would like to take a moment to share a patient story that demonstrates how our care management model captures the essence of what we do and the impact we're making one person at a time. Within 1 day after a hospital admission for a behavioral health diagnosis, the parents of a 16-year-old received a follow-up call by our transition of care team. The Spanish-speaking parents disclosed that their child had a history of depression and anxiety, leading to physical symptoms, inability to focus, absenteeism, and overall performance in the classroom. Alivio's care management team provided ongoing follow-up care with our Spanish-speaking adolescent psychiatrist and behavioral health team for outpatient therapy. The parents and behavioral health staff work with teachers and school counselors to identify the best options for the patient during this transition. It was decided that temporary homeschooling was best for this patient, and they were certified to receive homeschooling. The transition of care model is critical to this treatment process that oftentimes in traditional settings is overlooked, leading to breakdowns, fragmented care, hospital readmissions, and increased costs. I'm happy to report that, yes, thank you. I'm happy to report that this patient is doing much better and is anticipated to be back in school in the fall. Thank you very much.
Thank you. Then thank you all for speaking with us today and your partnerships with us. It's greatly appreciated. Thank you for sharing.
There are no other registrations.
There are no registrations. Thank you. At this time, I'm going to take something out of order. I have the ability to do this. So at this point, we're going to actually, after Director Bott says hello, you have to leave, everyone, expect. The board will now actually go into closed session. Action is expected to be taken in the open session after the discussion in the closed session. Directors will convene. Everyone can stay here. We're going to convene to the board meeting.
No, they didn't clear up.
Huh? Definitely. Okay. That's fine. Okay. I'd like to entertain a motion to go into closed session pursuant to the following exceptions to the Open Meetings Act, 5 ILCS 120-2, C 1, 2, 11, 12, 17, and 29. A roll call vote is needed. Madam Secretary?
Move in second.
I'll make the motion.
Okay.
Motion, yes. Second?
Second.
Thank you. The motion has been made and seconded. Madam Secretary?
Roll call vote on the motion to go into closed session, aye or nay. Director Bott?
Aye.
Director Curry? Director Garza?
Aye.
Director Harrington?
Aye.
Director Kim? Aye. Director Ryder? Director Robinson is absent. Director Sorrell?
Aye.
Director Webster Cross?
Aye.
And Chair Taylor?
Aye.
You have 9 yeas and 1 absent.
Thank you. The motion carries. We'll now convene into closed session.